Okay, so pretty much got everyone here. Good morning, everybody. Let me just get started here. So this is now technically the first provider training session we're going to do on Tuesday mornings. And I'm going to actually start from the very beginning I guess an explanation of Doctors on Duty and its purpose and your role in it. This is both for DOD managers and for clinicians. And one thing I wanted to stress is that as new clinicians, you're joining a team, but you're joining a team at the top where your training is going to involve leadership training and how to lead a team and how to set the tone in the clinic. And I think the best way to start that training is now. The best time is now. And the best way to do it is to share with you our strategic plan and our vision that we came up with 2 years ago. And we share with our managers. And now I'm sharing it with you as future leaders. And I'm going to start at the very beginning. Our mission statement, we completely redid this, and it is the mission of Doctors on Duty medical clinics to provide timely, compassionate, and affordable medical care to our community. We believe a positive and supportive work environment is fundamental to achieving our mission. And I'll talk more about that second line here in a minute. Our vision, the vision of the organization, is to search out the best medical and customer service practices nationally and apply them locally to become the preeminent urgent care provider on the Central Coast. That's where we're trying to go. We came up with a set of values. Number one is we can always improve. That everything we do can be done better. We just have to figure out how. And that may be, looking at other organizations or even looking at different clinics within our organization. So that's number one. The health and well-being of our patients and staff is our primary concern. Giving back to our community makes us stronger. Listening is more important than talking. Empathy and compassion are our greatest strengths. And we're not afraid of new ideas. So we try things out all the time here at Doctors on Duty. And frankly, that's the only way to find out if something is going to be something you can do better. You can't really get better if you just do the same thing all the time. We typically pilot things out here at the Lighthouse Clinic, and some of them work and some of them don't. And we roll out the ones that work to the other clinics, and then we try something else. And I think one of the strengths of our organization is that we're not afraid to try new ideas, and we're not afraid to hear new ideas from staff and providers. So I want you, as you go through your career here, as you do things and see things, and you find or feel there's a better way, maybe a more efficient way of doing something, or a totally new thing to add that we haven't thought of, I want you to let your manager let me know in an email, so we can look at it. Okay, that's how we get better. We realized that keeping our staff and really healthy and looking out for the well-being of the staff was really important during the depths of the pandemic. So we've added that as an equal concern as the well-being and health of our patients. We see our DOD staff as 50% of the people that we're trying to get 5 stars from. So just, kind of keep that in mind. And if you've got a 1-star comment, we want to know it so we can fix it. Okay. Giving back to our community, this is something that, we do through programs like the MAT program, the Bridge Clinic, the mobile clinic. These are things that, frankly, are not money makers at all for us. Our behavioral health program. These make the community better and stronger and more resilient. But most organizations would probably choose not to do them because they take resources and don't really add revenue to the organization. But that's part of what we want to be doing. Listening is more important than talking. I think this that sort of says it all. This is something that I remember every time I go into a patient room, that it's always more important to listen. And empathy and compassion are greatest strengths. It's sometimes hard to be empathetic and compassionate to some of our patients. They make it very, very difficult. Sometimes they're in a very, very bad place and take it out on us. So, but we always have to try to remember our empathy and compassion. The pillars of our practice. Number one is we want our patients to have a positive experience every time they come in the door. And that can mean different things to different people, and we can talk more about that later on in this. Employee engagement and empowerment. Our employees are the people who make a positive experience for our patients, and we want to make sure that our employees, are meaning both our clinicians and our front and back office staff members, feel like they have the power and the okay to make those decisions on a day-to-day or minute-by-minute basis that lead to a positive patient experience and a positive employee experience. So, if for example, someone notices or realizes it's an employee's like 1-year anniversary, we all want to know that, and we want to recognize that. Community stewardship and quality clinical outcomes. Community stewardship is something that I think we're strong in. We have partners with many organizations in the community, more than any other urgent care in Monterey or Santa Cruz County, frankly. We work with Natividad and CHOMP on helping with their patients being discharged from the hospital. We work with in Sleeves Valley with the community, with the program for patients coming out of that hospital, the Bridge Clinic. We were founding members of the Prescribed Safe initiative. We're working with a CHOMP on a grant called the Drug-Free Communities Grant. We also just started working with them on a local Monterey County grant for improving the mental health of children in the community. And we will continue to do things like that. We're working with HIP up in Santa Cruz County. We just got a joint grant with them. I think our piece of it's about $200,000 to improve the follow-up done on children with positive ACE scores. And so you'll see the results of that over the coming next 24 months. It's also going to help beef up our community health worker program. And number 4 is just as important as the rest. we have to make some profit to make all these things come true. We don't make a lot of profit. Honestly, Doctors on Duty profit goes pretty much right back into its services, its staff and clinician wages, renovations in clinics. Our hospital affiliate is not really concerned with how much we make. They don't want us to lose money. And so when I come around and anybody's coming around and talking to anybody in the clinic, any of you about scoring, Epic scores and level of service and looking at 99212s and why we shouldn't be getting those and things like that, it's not because we're trying to drive this giant pile of money higher, higher, higher. It's so we make something so we can keep going. So that's really where it is. I want to go into a little detail on some of these items. We came up with, we took this list of things we want to do and broke it down into goals and a plan for that goal. For creating a positive patient experience, goal number one was, before patients even get into us or as they come up to the door, we want to try to anticipate, respond to the needs that they're going to need. One of our biggest complaints, it always has been, we're trying to work on, is the frustrations our patients have with issues at the front office, just the whole registration process, mistakes and writing down things on paper. And so two of the things that we're working on for that, one is a new piece of software from Epic that has been in the pipeline now for almost a year. It's hit many roadblocks, but it's actually coming out on the 15th of October. So in about 3 weeks, you're going to see this software. These patients will probably start talking about it. It will be purely up in the lobby, and essentially patients will be able to come in, and we'll have a series of iPads at the front desk where they can do probably 90% of their registration, including putting in all their insurance information. It allows them to take pictures of their driver's license and their insurance card, so we don't have to go make copies of those. It puts the information directly from the iPad right into Epic, which should eliminate errors. It should be faster. And it should really free up our registration desk employees to be sort of more welcoming, to answer questions and do things besides just enter data. So that hopefully that'll really help. That's a pilot program that'll happen here at the Lighthouse Clinic. Will go on for probably a couple of months while we get the bugs out of it and see if the hardware we have works and things like that. But that's something that you're going to see rolling out to other clinics. About a year and a half ago, we switched to a new phone system. This was part of Goal 1 and the plan for Goal 1. And like some new things we try, it wasn't an instant success. We've had tremendous problems with it. We basically switched from a landline program, a phone service through AT&T to a VoIP system, so a voice over internet system that actually connects all our clinics with the corporate headquarters. And it was supposed to make it easier to communicate between clinics. It was supposed to have make it easier for patients to communicate with us. And up until recently, it's been a complete disaster. We brought in a consulting firm in May, I think, and they have reworked the entire thing. They've actually got now all our fax lines, which were our last line lines, are now coming electronically. They come directly into Epic now, so they don't. You'll see that may have already noticed that's gone away. So we shouldn't see paper coming through our fax machines anymore. So this hopefully is in the final phase of being tweaked to the point where it's going to be helpful. We'll see. Goal 2, improve and enhance the back office workflows. This is already in place. So these were plans that we put in place in 2020, actually before we went on to Epic. And one of the things that it has done is it enabled us to bring lab results and imaging results directly into Epic, and then directly out of Epic into my chart for patients to see. This has helped us a lot, and has cut down on communication errors and a lot of these communication requests for patients. So this has been really well. So we're goal 3 to improve our patient experience is to develop programs and partnerships focused on continuing staff and provider education. So what you're sitting through right now is part of that program. And we also have a recurring staff training program for administrative and clinical staff that we typically do in summer, usually done in July, where we bring in a speaker and have like a whole day of training for them. We're working on sort of the next phase of that, so that we'll probably start something along the lines of what we're doing here today for staff training, maybe having a monthly 30-minute session with them. Goal number 4 is to leverage resources to enhance Doctors on Duty's community reputation. And one of the ways you can measure this is these 4-star average ratings on these different social media platforms, and that's what we're going for. Right now, I think we have 6 of our 9 clinics are 4-star Yelp entities, and we're going for all 9 of them to get that certification. And that's just a constant job that the providers, the managers have been working on. But there are other ways to enhance our reputation in the community. I respond to personally requests for media communications all the time, and so we get those all the time, and we respond to it. So we are kind of a go-to source when local papers and local organizations want a talk on COVID or monkeypox. I think I'm doing a monkeypox presentation for CSUMB next week. Enhanced care team well-being and training. One of the goals for doing this, there's 4 goals in doing this, is encourage lifelong learning through training and education opportunities. I'll go through this quickly. There's a lot of this is for managers. Managers were using the MGMA, which is the Medical Group Management Association's training programs. Or the Urgent Care Association also has training programs for managers, and they have a series of webinars that we're making available to our staff. And number 2, track, analyzing, or recognizing strong job performance. We try to give feedback to staff. You've probably seen things in the break rooms about when they get mentioned in a review from a patient. We want to make sure we recognize that and put it up on the board so everyone sees that accomplishment. And then we're bringing our staff in at least once a year, not just for like staff reviews, but to make sure they're happy here, and that see if there's anything we can do to make sure that they stay with us. So again, goal 3 and 4 in here: strengthen the sense of connection with Doctors on Duty team. We have an annual all-staff training. I talked about that in the summer. We've also in the past, up until the pandemic hit, had a winter provider training, and we're going to restart that. I'm hoping to redo that. Probably it was okay in the winter, but it was kind of dark and dreary in the winter, and I'm thinking that we're going to push it out into the spring, so we could do it somewhere like maybe Pasadena. We could do it sort of sitting outside, and it'd be a little more fun. for the providers. So we'll probably hear about that coming out probably in March or April. And we want to be a company that supports a culture that attracts and retains exceptional employees. This is one of the ways we're doing this is acknowledging milestones in our staff retention. So we have people have worked for us 5, 10, 15 years. We've got people who work for us for 27 years. I think that's Judy. We want to make sure that everyone knows that. When we have, this is mostly for staff, when we bring them in to the clinics, we want to make sure we recognize that they're new employees, and we assign them an ADP onboarding mentor, which is different from the clinical mentor we give you. Excellent community health outcomes. Goal 1 is to support and grow volunteer opportunities for our staff and community. We're working on this now harder than ever because we've had a few opportunities to work with the homeless population over in Salinas, but we're really kind of ramping this up now that we've joined the and sort of created a partnership with the Blue Zone Project, which I'll talk more about here in a minute. We've already started doing some of this here at the Lighthouse Clinic. We've had actually two kind of community charity events that we went to. We took the staff to. We cleaned up 2 parks. We cleaned up the beach one time here, and we cleaned up a local park in Monterey over the summer. And we'll be doing more of those as we roll out the Blue Zone Project to other clinics. The goal number 2, to identify and utilize internal and external resources to increase our participation in local health initiatives. These are a lot of these are community boards and things that Katie and I are part of and represent Doctors on Duty. We're on advisory boards for the 3 local schools that turn out medical assistants. We work on a committee at the CSUMB for the PA program and for the nursing program up there, as well as their health center. So it's things like that keep our sort of our name in the pots and our face at the table. Increase our capacity to measure, coordinate, and communicate our Alliance population health needs. So we're working on this. This is sort of an active thing that we're working on right now. As the Alliance sort of pushes out their CBI measures, what they typically do is once you get good at one, they then push it further and have you do the next step. So we've gotten very good here at DOD, and most of their alliance partners have measuring social determinants of health, and through ACE screenings and through the state healthy assessments. So the next step is they're going to. We used to get credit for just doing those, and now that credit is going to sort of phase out. And what we'll be getting credit for is how we're addressing the positive findings or the negative findings, however you look at it, for the social determinants that are negative determinants of patients' health. That's going to be through increased referrals and increased use of our community health workers to help those patients out. So you'll see that kind of as something else everyone's going to be talking about very, very soon here. And those CBI measures will kick in 2023. Goal number 4, minimize our energy and waste footprint on the community. So this is something that was already was as part of our strategic plan, but we didn't really have a solid plan to actually do anything about it until I contacted the Blue Zone Project about a year ago and asked them what the process of getting Doctors on Duty certified as a Blue Zone project. And I'm not going to go into I'm not sure how familiar you are with the Blue Zone Project. I'll let you look it up on your own. It's too much of a discussion for this morning, but it's basically an organization. It's a nonprofit it's been based in Monterey. They go around and they go to different counties. They're in Monterey County now. They're supported by Taylor Farms, Stevens Family Memorial, and Chomp. That's where the funding comes from. And they go into businesses, restaurants, hotels, and basically set them up on a sustainable pathway that is both sort of sustainable for the environment and for the staff. So they actually helped us. They helped us create these opportunities for all our staff to get together and go do things together on the weekend, clean up the beach and other things. And I'll say that talk, but it looks like about mid-October, Doctors on Duty, Lighthouse will be the first outpatient medical clinic in Monterey County to get Blue Zone certified. So we're going to be really proud of that, and we're going to then go clinic to clinic and continue the rest of them. This is just coming down to our last slide here. Improved financial performance. So this is part of that last thing. We have to make profit, right? So improved financial performance comes from creating a structure to ensure improved quality of care metrics. In this case, I'm talking mostly about the CBI milestones for the Alliance, because that's the way through the quality of care we provide to Alliance patients. That's the most direct way that we get increased revenue, period. So the better we do, the more money we get given in sort of rewards for that sort of behavior. And so this is something that we're highly active in right now. A lot of this is going on in the background. You don't see actually in the clinic. It's going on with the hospital. We have a whole team set up that are working on this. But these are the type of things. This is where things like clearing care gaps in the chart, and you see an Alliance patient is so crucial. This is where it gives us revenue so that we can continue all the other projects that we want to do. Projects, frankly, like the behavioral health program. Probably, with Laura Slippy's, line of service and her services to our Alliance patients are really crucial to the health of this population. And, frankly, it is a money-losing project. So it is not sustainable on its own, and has to be supported by the rest of the profits of the organization. And that's where, this coding is really important. CBI measures are really important. Care gap clearing is really important, so we can continue to, continue employing her and Maria, and, as a community health worker, and even try to expand that program. Okay. So goal number 2: develop a schedule to regularly assess and revise internal programs and workflow. This is again something going on in the background. So in 2020, we decided we really need to look at our specialty clinics like ortho, pain management, or psych, OMT. I'm not sure if you're familiar with OMT, but osteopathic manipulation therapy, which is done by Dr. Luder over at the Salinas Clinic, is the service line we do. When we started looking at that, that's where we realized our ortho, pain, and OMT are actually doing fine, but we actually have to support the psych department. DOD onboarding versus ADP, that's mostly for front and back office staff. So and exploring goal number 3 for improving our financial performance, exploring alternative revenue options through participation in grant and incentive programs. We've actually been incredibly successful doing this. I have to give all credit to Katie for being just an eagle eye and just going out and looking for these opportunities. In 2021, we were awarded a Department of Healthcare Services Behavioral Health Integration Grant, close to $1 million to help us expand and support our behavioral health program that's still going on. And we've also recently, just recently received about a month ago, health integration partnership grant through Santa Cruz County to help with our ACE program responses. So it's going to help set up a sort of centralized program for services available to children and young adults that are struggling due to issues at home. So we've been really successful with that. And again, the goal number 4 is just generate a small profit, a 5% margin, which is not a great profit margin, but that 5% allows us to do all the other things we do. So that's one of the ways we're doing that is we're actually renegotiating our contracts with all our insurers right now. We're doing that with the partnership with the hospital. Those negotiations typically take like a year. And so that started, I think, in June. So we'll see what happens sort of next summer on that. We're sort of at the end of today's sessions. Any questions? One of the reasons I wanted to share this with you is because I realized as I was starting to go through topics to discuss and to bring up, that I wanted the most important topic I could share with you is our overall vision, and tell you and make sure you understand that you all are leaders in your clinic. So you come out of school, you're new in a sense, but your future position in the clinic is a leadership position. Your work habits and your attention to detail, your sort of gentle pressure to get care gaps cleared and various other quality measures taken care of in the clinic is going to set the tone for wherever you work. And I just want to make sure you understand that, and that the staff already look up to you and they turn to you for advice. And so I just want to make sure that you know where you're headed, and it's to be a leader in your clinics. So I'm going to let you go. I'm 6 minutes over. Does anybody have any questions? No one? Shayna?
Yes.
How are you been doing?
I'm great. How are you?
Good. Good. Can I ask you guys, how's the I know Clay and Caroline, you were in the procedure class. How did they go?
It went really well. I think David Anthony and Bill Coggin did a really good job in spiking some interest in doing some other procedures in the office, like the steroid injections. A lot of the other mid-levels were very interested in it and wanting to continue to learn about it.
Oh, good, good. I was really disappointed. I couldn't spend more time in there because I really wanted to watch how that went. And I'll tell you what's the next step of that is. I have, and I think I said it in the room. I have knee, shoulder, and hip models coming that'll be just like the ankle model. They should be here next month. So what I'm going to do is I'm going to start setting up probably a quarterly little class like that, and have Bill, probably Dr. Schumann, and I, teaching it. And which is a voluntary thing, whoever wants to come and learn, we will probably do a 2 hour, class like that, maybe on a Saturday or Sunday, throw in a really nice lunch.
That sounds good.
Yeah.
And then the
Pasadena.
other thing that a lot of people liked was the advanced suturing techniques. I enjoyed it because there's a lot of things that I didn't know that they perfected in that class. We were able to get some one-on-one training, hands-on. I was able to grab some of the extra supplies that they had so that we can use for our in-clinic trainings if you wanted to use those.
Good. Yeah, I stole some pad. Well, I was given some pads. They basically, as I was walking in the door, they said it was okay if I took them.
I think the best thing that I got was the QRS codes for the different types of suturing that you can scan, and you're able to watch the step-by-step YouTube video. Yeah, there were some of the techniques that I didn't know. So I was doing it with David Anthony, and he was showing me the ortho way and how to do some of the suturing that was a little bit different from the videos. But I liked it. There was also some additional supplies for nosebleeds that we went over. I got to take some of the expired samples that I can show you that would be beneficial in the offices.
Okay.
I think
I'll be over your neck of the woods later this week, so I'd like to see.
Okay.
Okay. Are you just, can you bring them in with you? And so
Yeah.
That'd be great. Thank you.
And they gave me a link to look at some pricing. I was going to sit with Miguel sometime this week to see if what we can find on McKesson.
Okay. That's great. Anybody else? I don't want to, I've taken too much of your time. Anybody else have any comments or anything about the conference? Okay, we will adjourn. And so this Thursday morning, I believe, is Dr. Schumann's talk, and then next Tuesday we'll start most likely with a clinical topic to talk about. Okay. All right.
Bye.
Take care. Have a great day, everyone.